So today, just very quick discussion because I get asked this periodically, not a lot because not a lot of people out there train, but I get asked periodically when working with a new patient who's been referred into us from an auto accident or slip and fall or something like that. Every now and then, one of these people also likes to go to the gym, also likes to do some form of training, and one of their big questions typically after the first 7 to 10 days is when can I go back to the gym? And I always encourage them to get back to the gym now, right? Get back in there, start doing the things that you were doing before at a reduced frequency or reduced intensity, reduced volumes, but start getting back there and doing things as soon as you are comfortable, as soon as you feel like you can tolerate it, as soon as you feel like you can adapt to the stress of training again. Because accident leaves people with different levels of injury, different levels of psychological stress and things like that. So there's a lot going on, and perhaps at that particular moment, those first couple of weeks, while they're talking to their attorneys, sorting out with insurance companies, things like that, maybe getting back into training, and they're sore, depending on on the severity of the accident, maybe getting back into training in that first week or two may not make the most sense, but it's not necessarily contraindicated either. Um, as long as people are able to find exercise or adapt their normal exercises into variations that they can tolerate, that don't cause big increases in pain while they're doing the exercise, don't cause big increases in pain that feel like they're setting them back days after they are exercising, they're perfectly fine to go. Most of these folks that we deal with, they think that by getting back to their normal functions, training and exercise, they are going to further injure themselves from what had already happened at the accident. That's not really the case. Starting, once kind of those initial shock of the accident wears off and some of that initial inflammatory process starts to recede from any strains, sprains that may have occurred, some nice, manageable, tolerable, progressive loading at an easy tempo is better for them than anything I'm going to be doing as a clinician. Most people are just looking for the passive way out, and that's fine. They're going to take a lot longer to recover. But those folks that are willing and able to get back into their normal routines and training and exercises after the accident sooner, feel better faster, have better outcomes, and are always quick to thank me by putting them at ease and getting them back into the gym. So don't hesitate too much. And if the person you're working with is telling you to avoid going to the gym, it's probably not the best advice. Getting somebody back to take care of themselves is always going to be better than whatever stuff I'm doing to them here. So with that being said, hope you enjoyed that. Take a look at my channel for more, and see you next time.